This is Radio Health Journal. I'm Nancy Benson. This week, obesity may soon overtake tobacco as the leading cause of preventable cancer.
Obesity is a risk factor that is rivaling smoking in regards to risk of developing cancer.
How your weight could impact your risk for cancer when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Once financially got cut from me, I was actually working 3 jobs. I was working about 72 hours a week.
Why it's important to understand the financial aid process. Then,
the idea of traditional masculinity is, to be honest, just a complete fabrication. The idea that men are supposed to be strong at all times is something that every man knows in his heart is not true.
How do you view masculinity?
These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Tobacco is the top cause of preventable cancer in the United States, but that could change in the next 5 to 10 years.
Smoking is the number one cause of cancer, but obesity is a huge influence on cancer. It's coming up pretty close to where tobacco is. Almost, I believe the number is 40% of cancers may be related to obesity.
That's Dr. Anthony Perry, chief of the Department of Outpatient Medicine at Cancer Treatment Centers of America. He's also an advocate for increasing public awareness and education about obesity and cancer risk. He says the two are related. And as almost everyone knows, America's weight problem is getting worse. That means there's an increasing percentage of the American population whose weight may raise their risk for cancer.
When you look at the American population, a large proportion of the population qualifies to be at least overweight. And actually, it's again 40% are obese, meeting the criteria. And what we typically go by in what's characterized as obesity is a body mass index of greater than 30. And so while it's not a perfect measurement of a person's overall fitness, it's the one that most of us go with because it's relatively easy to determine based on what a person's weight and, overall height is.
However, Perry says that cancer risk related to obesity is more complicated than just BMI. It also depends on the type of fat someone has.
It's primarily the central fat that's within the abdomen that is metabolically active. And when we look at what that is, it's called visceral fat that's the problem. It's the fat within the central abdominal cavity that does bad things. It can promote its own hormonal system of regulating insulin release and pro-inflammatory, chemicals that are at the root of what we think may have something to do with cancer occurrence and reoccurrence.
This visceral fat is key to understanding how weight can be tied to cancer risk. It's the kind of fat that produces an apple-shaped body and lurks near organs such as the liver and intestines. People who are overweight or obese are more likely to have visceral fat, but it's not limited to high BMIs.
This is an association with cancer, so there's not a direct causal relationship that has been proven, but the linkage is real. And the issue isn't necessarily that if you're thin, you're going to not get cancer, because again, there's a million other factors that factor into why a person gets cancer, but also it's the visceral fat that's specifically what we concern ourselves with in regards to cancer risk. And again, visceral fat is what's within the intra-abdominal cavity, not necessarily the love handles that a person has.
Obesity and the presence of visceral fat can also be linked to specific types of cancer.
There's a number that are associated with obesity. I think the ones that we know about are primarily certain types of esophageal cancer, specifically called adenocarcinoma, stomach cancers, colorectal cancers, liver, gallbladder, pancreas, breast, endometrial, ovarian, kidney, thyroid. So I think the total is 13. Now, some more than others. So, for instance, endometrial cancer is very strongly associated with obesity.
Considering the link between weight, visceral fat, and cancer, weight loss could be the solution to lowering the risk of developing cancer or its recurrence. Perry says there's not a lot of research on this, but studies are being conducted to test the effects of weight loss.
From a theoretical standpoint, certainly lowering your BMI reduces your risk of getting the cancer. I think the second part of the equation is that if you are diagnosed with cancer, does losing weight reduce your risk of recurrence? And the answer is we don't know yet. And actually, there are studies that are currently being undertaken that take a look at weight management and recurrence rates of cancers. And it makes sense. We believe that it probably will come to fruition, that it will reduce cancer risk.
Perry is hopeful that weight loss could decrease the occurrence and recurrence of cancer. But as anyone who's tried to lose weight would tell you, it can be really difficult. Perry recommends certain approaches for healthy and effective weight loss.
The old paradigm of exercise more and eat less, there's a number of different steps that need to be taken, and a one-size approach doesn't fit everybody. Certainly, when you look at what is effective with weight management, exercise alone is not an effective way to lose weight. It is a critical piece in not only helping with dietary changes, but maintaining weight and then keeping it off. And that's where exercise plays a role.
The second factor to losing weight is diet. There's no one diet that works for everyone, but consistency is key.
When you look at the different types of diets that are out there, they're all relatively effective if you can stick with them long term. Very low-calorie diets do work. The difficulty is that it's hard to maintain them. And so some of the more restrictive diets where you can cut out carbohydrates or weight loss plans such as meals that are made for you, again, they work, but the issue is you have to kind of meet the person at what is going to work for them long term.
Perry explains how he discusses long-term diets with patients.
We talk about trying to eat on a schedule to regularize their eating habits. We also talk about food selections that are sustainable for patients. We also talk about, so what happens when you have a special occasion that you're going out for a birthday? How are you going to modify what you do? And then how do you stay motivated, especially when you meet that plateau?
Although weight loss is complex and can be difficult, it can have many positive effects.
I've had patients who have lost weight primarily to not only help with their cancer recurrence risk, but also to affect their quality of life. So there are absolutely studies that show that patients who are able to lose weight have less fatigue, better body image, their comorbidities are less. And what I mean by comorbidities are things like long-term things that affect cardiovascular health, like diabetes and hypertension are reduced.
With obesity projected to overtake tobacco as the #1 cause of preventable cancer in the United States, Perry says it's important to understand how body fat and weight play a role. The exact link between weight loss and cancer reduction is still unknown, but losing weight can still lead to a better quality of life for more than half the population, without regard to cancer risk. Our writer this week is Morgan Kelly. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
New research shows that healthy lifestyle choices may dramatically reduce the risk of dementia. 5 studies presented at the Alzheimer's Association International Conference 2019 in Los Angeles show that lifestyle factors such as a healthy diet and exercise may even counteract genetic risks for dementia. Dr. Maria Carrillo is Chief Science Officer at the Alzheimer's Association.
While there is no proven cure or treatment for Alzheimer's, a large body of research now strongly suggests that combining healthy habits promotes good brain health and reduces your risk of cognitive decline.
Along with a healthy diet and exercise, steps such as building a cognitive reserve through formal education and cognitively stimulating jobs also help provide maximum memory benefit. The new research suggests that adopting 4 or 5 healthy lifestyle factors rather than none or only one may reduce the risk of Alzheimer's dementia by nearly 60%. Find out more at alz.org.
The summer season offers a chance to break from the routine, whether to try new activities, visit new places, or simply relax more. A shift in schedules can mean a shift in eating patterns and more reliance on snacking. That makes healthy choices all the more important. Registered dietitian Courtney Romano is a health advisor for the California Table Grape Commission.
When it comes to summer snacking, fresh fruit is always a great choice. For a super grab-and-go snack, choose grapes. They travel well. Grapes are also healthy and hydrating, and always a crowd pleaser. Try freezing grapes for an all-natural frozen treat. They're like mini sorbets.
Grapes from California are in season now. Grapes of all colors, red, green, and black, are a natural source of beneficial antioxidants and other polyphenols, which research suggests contribute to a healthy heart. Visit grapesfromcalifornia.com for more summer cool ideas.
Electric scooters are fun, easy to use, and seemingly all over the streets. But several new studies find that e-scooters are also causing a growing number of serious injuries. One study by the CDC shows that 45% of those hurt have head injuries, while another 27% have broken arms, wrists, or hands. Half of those hurt say a pothole or a crack in the street caused their crash. Dr. Vidor Friedman is president of the American College of Emergency Physicians.
Emergency physicians are treating an increasing number of scooter-related injuries. Many of these are serious and can be life-changing, but many of these injuries are avoidable. The number one thing you can do to avoid serious injury is to wear a helmet. Scoot safe and avoid an emergency.
Studies show that about a third of those hurt are first-time scooter riders. Dr. Friedman advises to start slowly, follow the rules of the road, and be an alert rider. More safety tips are online at emergencycareforyou.org/scootsafe.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal. Coming up next week on Radio Health Journal.
In fact, you are increasing levels of beta amyloid. That is a hallmark of Alzheimer's disease, even after one night of sleep deprivation.
How not getting enough sleep is way worse for the body and mind than we ever suspected.
Then a radical diet to reverse heart disease.
Heart disease is nothing more than a toothless paper tiger that need never, ever exist. And if it does exist, it need never, ever progress. This is a completely benign foodborne illness.
All that and more on Radio Health Journal.